And last night, the Welsh Government chose to extend mandatory COVID passports to cinemas, concert halls and theatres from Monday, having already made them a requirement for clubs and large events in a major democratic cock-up last month. Now, Scots could face their own crackdown, with passes potentially being introduced to pubs, restaurants, cafes and leisure venues after Deputy First Minister John Swinney warned of extra action to avoid future lockdowns. Our freedoms are slowly slipping away, and I find it shocking we're just expected to accept this. But as ever, I want to know your opinion on this. You can vote now on whether Scotland should ditch plans to extend COVID passports in a poll on our Twitter page at GBNews, and I'll bring you some of your best feedback at the end of this item. Email me, dan@gbnews.uk. But first, so that you can make your decision, let's welcome Sally Jane Cutler, Professor in Medical Microbiology at the University of East London, and the social commentator James Melville, who is very anti these lockdown passports. So, James, you're a proud Scot. What's going on? You're going to have to potentially produce some sort of health passport before you can go and have a pint come Christmas time?
I know you've touched on this earlier, Dan. It's mission creep. Now, I have a number of problems with this. Firstly, on an ethical and liberal point of view, I don't have any time for vaccine passports whatsoever. Secondly, I don't think they're workable, which is a crucial point in all of this. It is like a clown world policy. They're not workable for a couple of reasons. Firstly, organisations will try and find a way around that. Secondly, looking at recent research from the hospitality industry in Scotland, based on what they've done with nightclubs already, takings are already down 46%. So it has yet another hammer blow to the hospitality industry. And the other aspect, which has been touched on a lot of times, is the fact that if you have the jab, there's a lot of evidence to suggest that it suppresses cases, in terms of serious cases. But there isn't the evidence to suggest that it stops transmission. So therefore, there's a danger that vaccine passports in venues, when people are very tactile, such as in pubs and nightclubs, there's a danger that it becomes counterproductive and actually causes a risk for more transference of the virus on a number of different levels. It is not practical and it is simply not liberal.
Well, let me bring Sally Jane Cutler in on that. So James, and I agree with him actually, says this could be counterproductive scientifically.
No, I don't agree it's counterproductive. I think, quite honestly, the vaccination, we've got really good, robust evidence that vaccination does actually reduce the number of infections as well as hospitalizations. It doesn't totally stop infection, as he rightly said, but it does reduce the number of infections by about 50 to 60%, which does have an impact. Sure, those people that do get infected, even if they're vaccinated, can still transmit that virus on to other people. That is true. But you're getting much less infection in that group.
Do you really want to live in a society where popping down to your local pub means that you have to produce to the landlord your health papers before you can order a pint? Do you want to live in a society like that?
I want to live in a society when I can still go to the pub. And if that means I have to show a vaccination certificate to get in, then I'm happy to do that. I went to France a month ago, and there they've got it operating really well. People are showing their vaccine
No, it's not.
passports.
It's a society divided, Sally. It's a society divided. James, I mean, look, this is the worry. We see this happening. Sajid Javid today refused to rule out the possibility of the over 60s being banned from being able to use public transport if they don't receive their booster jab. And what I don't understand, James, why is this necessary? I mean, we're 80% vaccinated in this country. You know, why do we need this?
Well, we don't need it. It's crass logic. Just going back a little bit onto Scotland as well, based on what they've done, for instance, in stadia and also nightclubs, they've got vaccine passports, but they don't have testing with it. I mean, if you're going to do anything with these things, you should be looking at testing. Then there's a sort of methodology and common sense approach about whether you're infected or not, there's a danger with vaccine passports that people might become complacent and just think, well, okay, I'll just be tactile and run the risk of spreading it around. And I agree with your point, Dan, it's creeping elsewhere. So we're now looking at over 65s getting threatened potentially if they don't get their booster, not going on public transport, particular trains, and losing some liberties there. You've also got an issue, for instance, with our healthcare workers, where potentially 70,000 healthcare workers will be turfed out if they don't take the vaccine in the spring, putting even more strain on the NHS.
Yeah.
The whole thing is crass logic.
And we've already lost thousands and thousands of care home workers, which we can ill afford because of these draconian measures. Sally Jane Cutler, very interested to know what you think about this idea of coercion actually being counterproductive, because the vaccine hesitant want to be able to make their own decisions based on education. And sometimes they need to take a bit of time for that. Have you seen the studies that say actually this form of coercion is actually going to entrench their positions rather than make them open to the vaccine?
I think it's not necessarily coercion. It's just actually making those people using that hospitality environment feel safer to actually be sharing that environment with other people. Personally, I feel safer in a restaurant or a pub knowing that people have taken precautions, that they've either shown a vaccine passport or they have shown a negative lateral flow test. Neither of those are foolproof. We know that sometimes the lateral flow tests don't always give an accurate result. They're easy
but nothing's
to fake.
perfect. Nothing's perfect in all of this. We know that. The vaccine isn't perfect either. OK, but then, Sally Jane Cutler, do you want compulsory flu jabs for everyone too?
No, I'm not saying that.
But why not? But why not? Because if you look at the mortality rates, they're becoming incredibly close to each other now.
I don't think they got that close yet. So I think COVID is still sort of...
Not by much.
Yeah, well, give me the stats. What do you say of the stats?
I'll get it. I've got it because Steve Baker got the government to finally admit it. Didn't he, James? Because it's not something that actually people like to talk about, the fact that the mortality rate is incredibly improved.
Well, completely. I mean, we haven't done this before. I mean, obviously, flu is a major thing over the winters as well. We're ready to draw the line this in terms of coercion and vaccine passports. There was something I read the other day, which is connected to this, was the Melbourne Cup in Australia. Vaccine passport event. And what happened at that is they had a major spike in cases, over 1,000 cases from the Melbourne Cup on a vaccine passport event. It also happened in a nightclub test event in Münster in Germany and also in Boardmasters in Cornwall as well. There is a danger by having vaccine passports, you are increasing the risk of spreading the virus. I am not anti-vaxxer at all. The vaccine has been very, very successful at suppressing and lowering serious cases, but I'm really concerned about vaccine passports on a number of different levels. One being the risk of spreading COVID because it doesn't stop transmission. Secondly, I just think it's unethical and illiberal.
Yeah.
I don't think there should be any place in society for something like a vaccine passport.
Well, I agree. And Sally Jane Cutler, just to let you know, and this was confirmed by government ministers, by the way. They don't like shouting about it for some reason because they seem to want to terrify everyone. But Steve Baker, who's been a great freedom fighter, got the government to confirm, and this was back in September, so it's probably even better by now, but the infection fatality rate of COVID-19 is now 0.096%, comparable to the flu.
Okay. So basically, I still think that we should try and make the environment as safe as we can. At the moment, look at the number of cases.
Should we ban cars, Sally Jane?
Look at the number of cases of flu at the moment. Look at the number of cases of COVID. When we're looking at 40,000 cases a day, new cases that is, that's actually a huge volume of transmission going on in the community. And I don't think
it's dropping. It's dropping.
No, it's gone up again. It's trundling along.
Look at the trend.
Up and down.
Look at the trend line. Well, it has. That's just a fact.
I would like to see some measures to try and reduce that community transmission so that we can actually see
Lock
each
us
other
up
at
again?
Christmas.
Lock us up again? Lock us up again?
No. I want us not to be locked up, and that's why we ought to tackle the community transmission level.
OK. Well, look, let me just repeat. 0.096 fatality rate, comparable to the winter flu. We're getting there, and it's just important that we stop terrifying everyone. Thank you so much to Sally Jane Cutler, Professor in Medical Microbiology at the University of East London, and the social commentator and anti-lockdown campaigner, James Melville.